Johnson, and we have Ryan here with us today. And Ryan is our youngest current patient with a herniated disc in his lumbar spine from playing football and basketball and baseball sports injuries. And you've had that for what, about a year and a half now?
About 2 years.
L4, L5 level. And you've been having back pain down your rear end, down your leg.
Yes, sir.
With that. And I just wanted to do this video to show you that you can be a young person and still get a herniated disc, which is where the nucleus pulposus explodes out through the annulus fibrosus and pinches on the nerves. It usually goes down into the leg, which is called sciatica or radiculopathy. And he's been to an orthopedic surgeon, and they said just wait for a while. Thank God they didn't want to do surgery on him right away, but let him try to grow out of it. But disc will heal on their own, but they are healed better when they are allowed to heal in a better biomechanical weight-bearing configuration. So that's why he's in here, for us to line him up and have his disc heal up better so he can get back into sports, right?
Yes, sir.
All right, let's take a look here and see. Let's have you flex your head forward and backwards. Get my pen here. Okay. Now his posture is not bad, but you can see he's got a little bit of a head tilt to the right, and his shoulders a little out front on the right. Pelvis shifted a little bit to the right of center as well. So is his thoracic spine. Cervical spine's a little bit to the left of center. We've been trying to change his sleeping habits and sitting habits, and some of that's going better, some of it's not quite working yet. But it will over time, won't it, Ryan?
Yes, sir.
Yep. Okay, so Ryan is our youngest patient that I do the ring dinger on, and I do it very cautiously because his bones are not fully ossified yet. But we're not going to pull on him so hard as to interrupt that at all, but we do want to create a negative vacuum within the disc itself so that the nucleus will suck back into the interior of the annulus fibrosus, which is the outer covering of the disc. The disc is a ligament. A lot of people don't realize that. It's the toughest ligament in our body. They used to didn't think the disc had nerve supply, but now they know that's the number one source of pain in the spine is the disc. There we go. Nice deep breath in through your nose. And relax it. Excellent. So see, I didn't pull too hard on him, but you still felt that all the way down, didn't you? And see how he's still kicking, see? Okay. There we go. Yep. When I decompress you like that, does it feel better in your lower back? Does it take away the leg pain?
Yes, sir.
All right, good. Okay, so let's come over here on your tummy next. Change this paper for you. I'd like to see makeup on the last page. There you go. All right. Herniated discs are very serious issues that you need to pay attention to. So if you have one, you should be evaluated by a chiropractor that knows what they're doing somewhere. Or if not, you can just come here. And you guys found this on YouTube, didn't you?
Yes, we did.
Yeah. There we go. Now see, I'm adjusting his SI joints too, and his sacrum straight superior to inferior away from the L5 disc, so it gives that L5 disc more room. And then I'm adjusting L5 straight P to A again to take the pressure off of the front part of the disc and push the vertebra forward, because when the vertebra come backwards, it's called retrolisthesis, and that's when they pinch on the nerves. So it's the combination of the three axes of adjustments, the X, Y, and Z axes, that gets results on people. I know I'm not supposed to talk when I'm adjusting so they can hear all the pops. I'm more about education and entertainment, so. There we go. My son's the only other person I've ever done the ring to around this his age. There. Because he had a little bit of scoliosis. See, you're exactly even now, Ryan. Does this feel any better to you?
Yep.
Okay, good. So take some deep breaths. I'm going to do the turbinator on you today. We got a brand new turbinator, by the way. Also recommended some aquatic rehab for Ryan, which is also very helpful in dealing with herniated disc and post-surgical knees, shoulders, elbows, wrists, everything. I'm going to get L5 one more time. Okay, let's turn you on your back now. Okay, you have to lay your head right on the head piece. There you go. Perfect. Bring his head up, back over his shoulders where it's supposed to be. There, now slide down this way a little bit for me, please. There you go. And then put your arms out like this. And we're adjusting his AC joints now. And the sternoclavicular joint, which is where the clavicle and the sternum meet right here in the chest. That'll square his shoulders off. And then the costosternal joint, which will also square off his rib cage and his chest. All this takes pressure off of the spine. No, lay back. Still gotta pull your leg. Can't get out of here without me shooting you and pulling your leg. There you go. You feel that in your knee and your back?
Yes.
Okay. And same here. Just relax. There we go. Good deal. Okay, let's face toward Joseph for a second. There you go. He's getting around pretty good for having a herniated disc. Let's get back this way just a little bit for me, Ryan. There you go. And remember to look straight ahead. There we go. That's it. And let's get one more here in your elbow and your wrist. There. There we go, good. Okay, now let's shoot you. Okay, let's flex you forward and backwards again. Yep, that's better. That was easier, wasn't it?
Mm-hmm.
Let's do this, and we're going to tilt a little bit to the left. See, we're bringing his whole head up and back up over his spine where it's supposed to be. That will reduce the weight-bearing load down here in the L4, L5 disc area. Okay, try that same thing again. Now, that should have felt smoother. You got equal spacing now. Ryan, I haven't scripted you on what to say to our YouTube subscribers, but you're a 13-year-old that plays sports and wants to continue to play sports. You've got a herniated disc in there. How has this treatment done for you compared to what you've done prior to coming here?
Well, the pain's actually been getting a lot better.
Mm-hmm.
I haven't been feeling as much pain.
Are you able to do more in your activities?
Yes, sir.
How about your leg pain?
My leg pain's getting better too.
Okay. What would you tell everybody about what you experience here compared to?
How it works.
Yeah, it works. That's good. That's a good line. This is your Houston chiropractor, Dr. Gregory Johnson from Advanced Chiropractic Relief in Houston, Texas. We'll see you next time.